Hi,
Welcome, Jerry.
Thank you very much.
So, Jerry, we're well aware that there are many thousands of radical prostatectomies done in the world every year. How common is erectile dysfunction after this operation?
You know, John, I see tons of patients on a regular basis, and sometimes I get to see them before their surgery or the radiation, sometimes after. And they all have the same question, you know, am I going to have erection and sexual dysfunction afterwards? And my answer is yes. The vast majority of patients, regardless of what they choose in terms of their therapy, are going to have problems with sex. Now, some men may recover function that's adequate for them to have penetrative intercourse without any medication, but most patients actually do have some ongoing problems afterwards. And I would say that they need to understand that going in. They're not going to have ejaculation. The erections probably aren't going to be as hard, regardless of what form of therapy they choose. But at the end of the day, we can optimize what function they can expect to have with active, aggressive care early on. And the understanding of that knowledge is really important going in.
So, Jerry, when men come in to see you and they say to you, what are the chances of getting back to baseline function? How do you address that?
So, you know, it's really a goal of all patients and couples that they want to retain what they have. The truth is, most men are probably not going to get back there. And it depends on what form of surgery. In other words, were both nerves spared? Were the blood vessels that are so critical to erection spared? Whether they had hormonal therapy or not. Their age really is a key factor as well. At the end of the day, to me, that probably isn't the most important factor. My goal of therapy is to get the couple happy, to let them understand that perhaps their erections won't be as rigid as they were before, but they can do other things. They can have penetrative intercourse, perhaps with the use of a PDE5 inhibitor or injection therapy or a vacuum pump. And the idea that they're open and talking about it and looking at all their alternatives is really critical to patient and couple success. But the bottom line is, men who have prostate cancer who choose to have either surgery or radiation or hormonal therapy likely are going to have a hit on their ability to get and keep a fully rigid erection.
So, in 2003, robotic prostatectomy became an entity. And the United States of America, at least, more than 90% of all radical prostatectomies are done using the robot. What's your take on whether that has improved sexual function outcomes?
The U.S. is kind of unique in that the penetration, sorry for the pun, but the penetration of robotic surgery is so much higher than the rest of the world. The good news, or bad news, I guess, is that there hasn't been a real difference in terms of the long-term outcomes of sexual preservation, regardless of the technique. Now, what I mean by that, it doesn't really matter if you do a laparoscopic prostatectomy, robotic, or open. If you have a good surgeon and they spare your nerves, long-term outcomes are pretty much the same. So that's good news for many of the countries in the world that don't have access to the robot, but kind of sad news for those of us in the Western world that hope the technology would transform the ability to get and keep an erection after that sort of surgery.
So we know that erectile dysfunction is a major concern of patients, but there are a host of other sexual dysfunctions after radical prostatectomy, for example, that occur. What do you speak to your patients about routinely?
You know, I think it's really important for the patient to have that communication with their clinician. And so many patients have the expectation that after their therapy, they're going to have erection problems. But of course, there's things like loss of ejaculation, which happens to all men, of course. And that has a major impact for some couples in terms of sexual pleasure, both for the patient and partner. Many men will complain of loss of penile length or girth. And we think that's because of the loss of some of the cavernous smooth muscle. And so they need to be aware that they're not going to be the same. They're going to be different. Some men, of course, will experience a little bit of a leakage of urine at the time of orgasm. And that can be a real problem in terms of the sexual interaction and response. So there are a host of other factors that can be impacted in terms of the sexual activity that men and their partners need to be aware of. The good news is that most of those issues can be dealt with. And there's some good data out there that shows that if they're really keen on preserving their smooth muscle, that use of PDE5 inhibitors in some patients may actually help. The idea that if their erection isn't as rigid as they'd like it to be, there are treatments, of course, whether it's pills or injections. And for some men, surgery is a good choice as well in those men who perhaps didn't have nerves spared. But ultimately, I think the key message I'd hope that clinicians would understand is that in men and couples who are undergoing prostate cancer therapy, that speaking to a skilled clinician to understand what options are available is incredibly important. The group of patients I see that is the most distraught after their interventions are those that really don't speak up, that don't dialogue with their clinicians, because many clinicians out there don't have the information they need and simply say, oh, you're cancer cured, you're successful, Mr. Jones, it's time for you to go home, without giving them the opportunity to speak to somebody who understands all of the treatment options that are available.
And ergo, the ISSM Movember initiative with this video set.
Absolutely critical.